Good evening, everyone. I just want to bring to the panel's attention, we're going to be starting in about 5 minutes. We do have some viewers that's viewing this online, so I just checked with our media person. So we're going to be starting in about 5 minutes. We're waiting on one panelist to get here. She got stuck in traffic, and she's one of the key panelists for us today. So five minutes or so, we'll be starting. So thank you for your patience. Not necessary. Oh, I don't know. I know. Good evening, after everyone. Thank you all for joining us today. I would like to thank you all for those that's in attendance in person and on virtual. We do have some viewers that's viewing this online, and those that's viewing online, I have to say, the end of the program is going to probably be the most impactful part of it, but we're going to go through the agenda. I would like to say thank you, Commissioner Aguilar, of the Cook County 16th District Commissioner, for accepting my request to talk about the opioid crisis in our community and how we can be more informed and educated. I grew up during the times of crack epidemic, and that destroyed black families, and I was one of those families that it impacted. So with so many illicit drugs on the market today, local leaders like myself have to face this head on and have the transparent conversation with members of our community. So I just want to say I thank the panelists and Commissioner Aguilar for accepting the request for us to be more informed and educated. Did you know that more than 1 million people have died since 1999 from drug overdose? More than 75% of drug overdose deaths in 2021 involve opiates. Opiates are substances worked in the nervous systems of the body or in specific receptors in the brain to reduce the intensity of pain. The number of overdose deaths involving opioids include prescription opioids, heroin, and synthetic opioids like fentanyl. In 2021 was 10 times the number in 1999. Overdoses involving opioids killed more than 80,000 people in 2021, and nearly 88% of those deaths involve synthetic opioids. Today's panel is Cook County Department of Public Health, Dr. Kareem Joshi. Did I say that right?
Kiran Joshi, thank you.
Kiran Joshi, I'm sorry about that. Cook County Health, Kiana Dordan. Executive Director Lori Fry from Live for Lali. Our Fire Chief, Chief Matt Martin. Police Chief Thomas Mill. The Village of Broadview Chaplain, Pastor John Harrell, and I have invited a special guest, the CEO and President of Habilitative Systems, Donald Du. I appreciate you all showing up for us today in Broadview. I pray that you find this information brought to you today will be helpful to you. And now I will ask Commissioner Aguilar for a few remarks, and we'll get right into the conversation.
Thank you, Mayor Thompson, and thank you very much for requesting this forum. As you said, it's a big issue, especially with our young folks. And correct me if I'm wrong, Dr. Joshi, but opioid use probably is becoming the #1 killer among young people.
It's increasing.
It's increasing, and it's devastating. It is a pandemic, and we have to address it as a pandemic, as an illness. I had firsthand experience in a family. I had a family member who overdosed due to opium, so it's affected my families, and it just doesn't affect one person. You have a person who uses drugs and overdoses, it affects the whole family and the community. We have to find a solution, decrease it, if not completely stop it. It's difficult. So this information is important. Again, I want to thank the panelists for coming out, and Mayor Thompson, thank you for hosting it.
Thank you, Commissioner. So we're going to just jump right into the conversation. We're running a little bit behind schedule, so we may go over a little bit, but then to respect people's time. So I'm going to ask the panelists to introduce themselves. I'll start with my leadership team, and then we'll just go down the dais, and then we'll just start the conversation and ask Dr. Joshi to give some opening remarks to get the conversation going, and then just let it flow. I want this to be an organic conversation, a very transparent conversation, and what it's like in real life and community. And I'm going to ask Donald Du to kind of elaborate a lot more on that, because he lives it every day on the west side of Chicago. So, Chief Martin.
Yes, hi, good evening all. My name is Matthew Martin. I'm the Acting Fire Chief for the Broadview Fire Department.
Good evening. My name is Thomas Mills, Police Chief for the Village of Broadview.
Good evening. My name is Pastor John Harrell, Village Chaplain of Village of Broadview, and also serve as a pastor at Proviso Baptist Church here in Maywood.
Hello, everyone. I'm Kiran Joshi. I'm a Senior Medical Officer at the Cook County Department of Public Health.
Good evening, Laura Fry, Executive Director at Live for Lali and a person in long-term recovery.
Good evening, I'm Donald Du, President and CEO of Habilitative Systems, Inc., and also Vice Chair of Wellness with Healthcare Transformation Collaboratives.
Good evening, I'm Kiana Dordan. I'm a recovery coach in the MAT program at Cook County Health.
So Dr. Joshi, you want to go ahead and share some data and stats of what's going on in Cook County?
Yeah, sure, thanks so much. So first I want to say thanks Mayor Thompson and thanks so much Commissioner Aguilar for the invitation. It's always a pleasure to be out in the community. So I usually start these conversations by speaking to how many of us have family, friends, loved ones, acquaintances that have experienced addiction. Just by way of a very personal note, I've had 2 family members myself who've passed away from addictions. Their drug of choice happened to be alcohol. but I think we can all agree that addictions are something that really don't know any kind of class, race, or other kinds of boundaries. They affect all kinds of people. And as such, I think it's really, really important that when we think about addictions, that we treat people with addictions with the same amount of compassion that we would treat someone with heart disease or cancer or diabetes. Addictions, in one way, are chronic diseases just like any other. And it's important for us to remember that because too often people with addictions are stigmatized. They're treated differently, and by differently I mean badly, by our system. So I think that's really message number one. Message number two, which I think Mayor Thompson spoke to very clearly, as did Commissioner Aguilar, is that we got a big problem on our hands. We got a big problem in our communities. The latest countywide data I have for a full year is from 2022, and it's that 2,000 people died of opioid overdoses. Again, this is countywide, so includes both the city and the county. Now, most of those folks did happen to reside and pass away in the city of Chicago, but the suburbs are by no means immune. I will say that back in 2015, which is among the first years that we have good data, you could measure the number of people that were dying from opioid overdoses with 2 digits. And now we're in the hundreds, right? So this is a greatly expanding program. It's increased nearly year over year. And one of the major drivers here are both heroin and heroin mixed with a drug called fentanyl. And if you haven't heard of that drug, it's basically a stronger, much stronger version of heroin. So just a little bit can be incredibly dangerous. And at this point, we're essentially treating everyone who experiences an overdose as someone who has overdosed from fentanyl because it's just so prevalent in the drug supply. So that's just a little bit of stage setting here, a little bit of the data and framing. I'm going to pause here and maybe let my colleagues speak as well. And defer to you, Mayor Thompson, in terms of.
Thank you, Dr. Goshi. So I'm going to ask Chief Martin to give some stats as is specific to Broadview.
Yep.
Because we deal with this on a regular basis. Our EMS, police department interact with people in the field, and so we have captured some data collection for specific to Broadview. Although the conversation is generalized within our region, within the Proviso Township, and then we look at countywide, but we have some local numbers as well. So Chief Martin, you want to chime in?
Sure, thank you. So we were able to pull some local data from our software reporting, and we went back to May 1st of 2022, and our local community has seen an overdose total of 94 patients that didn't require CPR, and then we've had 11 that did require CPR. And that was a total, that's a total of our entire response area. 81 of those 94 were within the village of Broadview. 7 of those 11 required CPR, and then we had some other smaller numbers that were in other areas that we have coverage areas for. And I think the driving message is that even small communities like Broadview have the same problems. The numbers are relative to the bigger problem, right? And we see the same impacts, especially being close to 290 with, the issues that a lot of other suburbs and city of Chicago see. So it's not just a problem for Chicago. It's a problem everywhere. And just to go off of what was said earlier, it has no barrier. It's here too, and it's very real, and we see it fairly frequently. So I actually pulled these numbers on Friday and had to adjust them just because of some additional numbers that we had over the weekend. So, it's happening that frequently.
So thank you. So the purpose of me hosting this was to bring awareness to the Village of Broadview that we're not exempt. We're not exempt, but how we work together collectively to help this crisis, to be interactive, to educate and give people the tools and the resources that they need to be able to help their loved ones inside the home. Because a lot of people, we can drive throughout Broadview. It's a very well-kept, small community, manicured lawns, properties are kept up, but we don't know what goes inside, what's internal in those homes. And a lot of what's internal is addiction. And so I wanted to be the one that step out and just have this conversation. And I know people are very private in this, so many of them are probably watching online to get the information. But today you will get some resources and some tools and some access to get help, to help you overcome this situation. So I'm going to turn it over to Donald because he have a much broader, he and I had a conversation a couple of weeks ago about this specific topic, and he had a much broader reach than what I have in Broadview, and I think he can bring something to the table because we interact with the west side of Chicago on a regular basis. We have a lot of good relationships in the city, and that's another avenue for people to have access to.
Thank you so much, Mayor Thompson, and thank you so much for your servant leadership. It's truly appreciated. Again, I'm Donald Dew, President and CEO of Habilitative Systems, Inc. I've been blessed to have served in this role for 33 years. HSI has been serving West Side community areas primarily for 45 years. We provide services to persons with severe mental illness, substance use disorder, developmental disabilities, working with children exposed to trauma and violence. And we also do quite a bit of housing for seniors as well as people with disabilities. We operate several programs that really address the issue of opioid and substance use disorder. We have our halfway house that is located in our main facility right on the border of West Garfield and Austin at 415 South Kilpatrick. We also operate, I'm sure many of you all have heard of Tabitha House right over on Pine Street, where we work with women in recovery and are battling, again, addiction in many, many different forms. We also provide outpatient services for intensive outpatient services for persons battling addiction. Literally, we see over 7,000 persons a year who are in some form of trauma and pain. Oftentimes, unfortunately, we experience what we call persons who are challenged with dual diagnoses. That means that they are challenged by both severe mental illness as well as some type of substance use disorder and opioid addiction. So we find ourselves having to work with multiple concerns. And of course, I would be remiss if I did not say that many of these same persons have chronic medical conditions that have to be addressed. So we're talking hypertension, diabetes, you name it, it's going on. And, Mayor, I'm not sure how far you want me to go into this, but it's just when we think about the fact that, we've got 15 different locations around the west side of Chicago, group homes, outpatient facilities, our West Side Community Triage and Wellness Center, which operates 24/7 from 4133 West Madison, all designed to answer one of the most critical questions before us this evening, and that is access to treatment. Many persons need treatment. They really, really need treatment. And let me also just say, because that may be my
That don't mean
up
your
already.
time is up.
Sorry about that. All right, that's my time.
No, keep going.
But, I've got to say this because I always like to say this in public forums. We don't want to blame the victim.
That's right.
Okay? We really, really don't want to blame the victim. Yes, do they need to take responsibility for their life choices? Absolutely. But please, please, please keep in mind that everybody grieves differently. You can have a fully functional, employed person taking care of their family who experiences some level of addiction and battling opioids. It can happen to any person at any age, in any race, in any religion, to anyone. So we don't want to put ourselves in the position to say, well, it's your fault, you can change if you want to. Not everybody's working with the same level of capacity, or what we call in psychotherapeutic terms, ego strength, okay? Not everybody's built up the same way. So what we want to find out is what can we do to create greater access to folk and in terms of the treatment and care that they need. And keep in mind, and I'll just drop this one statistic out here, 60% of adults, folks like this in this room, 60% of adults have experienced some type of adverse childhood experience, what they call commonly ACE or trauma. 60% of these adults have experienced some type of childhood trauma. Think about that for a minute, and think about the scores of children who are currently involved in the juvenile justice system, in the child welfare system, who are going through a constant state of trauma. Think about those children whose parents have been removed because they've been incarcerated or have been ravaged by opioids. Just think about the effect of those children. I remember, man, years ago, before anybody went to sleep at 10 o'clock, there was always one question that was asked on the 10 o'clock news. I'm sure you all remember what it was. It's 10 o'clock. Do you know where your children are?
Yeah.
We got to think about how this opioid epidemic is affecting our children, the next generation of folk who really be taking care of us as we get older.
Thank you, Donald. So now I'm going to turn it over, now that we've talked about some data and some resources that's available as it relates to the help that we can provide to people that may want to take advantage of the help. And so I'm going to ask Kiana to talk about what is the role of a recovery coach.
So, once again, I'm Kiana Dorton. I'm one of the recovery coaches at Cook County Health. So as a recovery coach, first of all, Cook County's approach is what we call integrated healthcare, which helps remove the stigma. So as opposed to, we don't dispense methadone. So as opposed to going to a clinic every day, you come into one of our neighborhood clinics, and you sit in a waiting area, just like any other patient. You meet with your provider, you meet with a recovery coach, and whatever other service person you may need to, and you receive a prescription, most times for Suboxone. So as a recovery coach, I actually work across 3 clinics in the Cook County. I work at the North Riverside Clinic of Cook County Health, Robbins, and we have a psych MAT clinic on the medical campus. So my role is to outreach, receive referrals, assess, and sometimes refer, depending on the level of care that the patient is willing to accept. However, we do practice harm reduction at Cook County Health, which basically partners us with patients so that they feel like, you know, they are the person in control of their own recovery. So even though I may be the expert in that situation, they're the expert of who they are. So we basically partner with the patient, make sure that they're coming in to get their medications, make sure that they're connected to whatever other primary health care that they need. We have recovery coaches in all of the 10 Cook County Health ACHNs across the county. And I believe Dr. Joshi, someone was saying about the young people. Quiet as it may be is kept, about 60% of my patients are 50 or over. I have patients that are 75. I have patients that are 60. I have more older patients. I have more patients from Burbank, Orland Park, Tinley Park, Arlington Heights. So this is not just a city, an inner city issue. It's very prevalent in the outlying suburban areas. And as a matter of fact, a lot of the patients that we get into the clinics in the city, once we work with them and usually get them, you know, going, get them on track, connected to services, we'll come to find out that their actual addresses are in suburban Cook County.
Yep.
Okay, so yeah, but the question was, what do I do?
It sounds like a lot.
A lot. So yeah, I'm a counselor, a friend. We call the patients, we connect them to health services, housing, treatment, meetings, whatever is needed. We even have right now what we call a bridge clinic. So you may call a person may call a clinic saying that they want assistance with their substance use disorder, their opiate use disorder. And I can assist them, but we may not have a provider to prescribe right then. However, Cook County has set up what we call a bridge clinic, where I can call the coach over there and have a provider call that patient within 24 hours and get them a prescription so that they can get started. These are, we're trying to remove barriers so we can, mitigate these overdoses. So if we can get a prescription in hand and Narcan education, that may be half the battle. Yeah.
Thank you. So we're gonna just chime right in and go right to Laura as it relates to, the importance of reduction and how we can support loved ones, because as you related to the Narcan, I think your outfit, your nonprofit kind of coach people on how to use it the right way to reduction. So I think that's a good segue. And then we're gonna go right to Chief Mills to tell us what are we experiencing Broadview on the streets and how we can support the police officers, because I'm hearing Kiana say, the level of outreach, how could we be impactful to your organization for outreach for the officers in the field? So Laura.
Thank you, Mayor and Commissioner. Thank you so much for putting this on and for being brave enough to talk about something that a lot of people hide from. Again, my name is Laura Fry. I'm the Executive Director of Live for Lolly. I've been with the organization for 11 years, and I came to the organization when I discovered my son was an IV heroin user. He's doing very well, by the way, now. Live for Lolly is an organization that was founded after the overdose death of a young man from Buffalo Grove. We are entering into our 15th year. We serve currently 7 counties: suburban Cook, Lake, McHenry, Kane, DuPage, Winnebago, and Boone. One of the services that we offer, it falls under harm reduction. For those of you that don't know what harm reduction is, it's basically reducing harms to people who use substances. We have a mobile outreach truck that has 2 sites in Maywood and 2 in Oak Park. Those are probably the closest ones to here. And what do? We give out toiletries, we give out Narcan, fentanyl test strips, snacks. We give out all modes of consumption. For those of you that don't know, syringe exchange programs are legal in the state of Illinois and have been since 2019. So people are able to get safe supplies from us and not face prosecution for having these supplies on them when they are a part of our program or any other syringe exchange program. So why do we do that? So often I hear the question, aren't you just enabling people's use when you give them smoking materials or syringes? And I challenge that. Yes, we are enabling. What we are enabling is life and the ability to stay healthy until people can make changes in their life. It is, and this is data, this is not my opinion, the first syringe exchange was started in the United States in 1982 in San Francisco, so we have many years of data. And what we see when we put a harm reduction program into a community is we see a drop in HIV infection, we see a drop in hepatitis C, we see a drop in crime, we see a drop in paraphernalia being discarded on the street, and we also see an increase in treatment. Because the biggest thing that we give out, and we have seen 8,000 people in the past year, the biggest thing we give out is connection. And I can't tell you how many times I have been, this just happened in Maywood to me 2 weeks ago. A person who's older person, probably a little older than I am, he had been coming to our truck getting supplies for a couple of months. And I was on the truck, similar age, similar substance use history, and I got to talking with them. And for the first time, this person said, "Can you tell me what it would look like if I were to want to go into treatment?" That's it, right there. And if that only happens one time in a month, that's a win. And I directed her to one of the clinics. Thank God for the Cook County clinics. We also have one right across the street from our office in Arlington Heights, and I can't tell you how many people have walked over there that have walked into our office. And that's exactly what we need. We need hope, we need connection, we need love, and wraparound services. And the Cook County Clinic across the street from our office, all services. There's a dental clinic, all medical services, mental health services, medication-assisted recovery. And when you wrap someone up in that continuum of care, there's less chance that they're going to fall in the cracks. And I think that's what we need to see more. We need to address root causes and not just send people to 28 days of treatment and expect them to be cured. Trauma doesn't work that way. Being someone who has lived with trauma that drove my own substance use, it takes a lot longer than 28 days. In fact, I've worked on it for 50 years. So to have those wraparound programs are really important. And it's just so awesome to be sitting here with people talking about treating people with kindness and dignity and respect, like any other disease. I will close with a little personal story. I am a cancer survivor, and we have lived in the town of Wakanda for 33 years. Small town, much like Broadview. Everybody knows everybody. When I had cancer for 2 years, I got 3 meals a week delivered. I got my house cleaned once a month, and I put my laundry out on the stoop every week, and it was washed, folded, and brought back to me. 3 years after that, my son became sick with a potentially deadly disease, much like my cancer, and we were shunned. There were no casseroles, there were no phone calls, there were no visits. And that was very difficult, very difficult. I wound up going out of my town to go grocery shopping because people would turn around and go down a different aisle when they saw me. But when I had cancer, everybody was there to help. We need to be there for these families with the same kind of compassion, like you said, if the family was dealing with cancer or heart disease or diabetes. Thank you.
Thank you. Chief Mills, can you tell us what we are seeing specifically with the police department in Broadview?
Yes, ma'am. Thank you, Mayor and Commissioner, for putting this panel together because as a lot of other people sit on this panel, this is a very important issue and one that has touched my family personally, where I lost my brother to a fentanyl overdose in 2020. And what was crazy about that, and I think about it often, is the time that he passed, I was a deputy chief for the Criminal Networks Group in the Chicago Police Department that oversaw all narcotics and gang investigations. And I knew it was going to happen. I just didn't know when. I actually expected it, and we've tried. My parents did everything they could, and it was just a matter of time. But what I have come to realize is that, like everyone else has said, people dealing with addiction, they're really great people. They're very loving, they're very kind. There's nothing they won't do for you. We just tend to see them when they're at their worst. But that's just an appearance, it's not their heart. And they were really good people. And I got that call from the University of Chicago Hospital because he was found on the street on 55th in Michigan. I knew he was a good person. So again, this is really a very important piece that I know we need to share. Because in the course of my career with the police department in Chicago, I also was an undercover officer where I purchased drugs. And what was huge is when I would get out the cars in various locations on the west side and would walk into garages and wait for the dope man to come. It wasn't just black and brown. There were all kinds and all color of people coming, not just from Cook County, DuPage County, Will County, coming down to 290, which was called the Heroin Highway back then. And they came, and it was funny because they would bump us regular Chicago people out the way because they had more money. When the dope man came out and says, how many? I would say 2, and someone else would say 20. So we had to wait till the next bag came out. So, you know, Cook County may have those alarming numbers, but it's just not Cook County residents. They're coming from all over into the city of Chicago, straight down this Heroin Highway. So just a little personal story. As it relates to Broadview, what a great community. A great community. We don't have a lot of numbers. We have no open-air drug markets, which I am glad to say because I've seen enough in the city of Chicago, and I know Mr. Dew and everyone, Pastor Rail, they see it. And I can say from in my time, we tried our best with working with the state's attorney's office, but as soon as you take one down, 2 pops up. And that's how it is. We have a phenomenal department where our officers are community engaged, where they know everyone. I tend to tease the mayor and the staff here, and I say, you know, Broadview residents are really spoiled because they know they know each other, and they don't have a problem calling the police station, the mayor, the village administrator, any other department head. So that's a great thing. Well, we didn't have that in Chicago. There was no phone calls. Our officers are trained with Narcan. One of the numbers we were able to pull since 2022, our officers have used Narcan 19 times, 5 from January to today's date, which is phenomenal. Like I said, because our officers are not afraid to interact with people who's hurting, who may have taken this fentanyl not knowing, and now they're in a position where they don't know if they're gonna live or die. And our officers, they're ready, they're prepared, they get out their car and they administer that, then they call the fire department who comes, and we work collectively together. Our police department, we have a social worker here that's 3 times, here in the police department, that's here 3 times a week. And our officers, when they interact with people, they have no problem taking their information, bringing it to our social worker, and our lieutenants and our detective lieutenant, they'll get together along with my deputy chief and they'll try to bring them in or visit. And I think that's a big piece of the wraparound service that everyone's asking, not just getting them back alive and then forgetting about them, because they see them all the time. So I think it's huge for police departments nationwide to not be afraid to interact with people who suffer from addiction and mental health, because mental health is predominantly probably 70% of police officers' problems on the street. They're good people, they're just suffering. And like Mr. Dew said, I remember Mr. Dew when I was a young sergeant in the 25th district, probably I don't want to say how long ago, but
You already did.
he was preaching this, and he's been real strong about this. And you know, the problem, it could be depressing because it looks like we can't gain ground, but if it's not for people sitting on this panel, yourself, Mayor, and the Commissioner, to keep it out in the forefront, we're making strides. You know, even if we save one life, and that's what our officers in Broadview, that's our goal every day, is to try to keep everyone alive. You know, we're not afraid to use Narcan and talk to people, like Deputy Chief Martin said earlier, just from the numbers we pulled over last week, he has additional numbers. So, you know, it's a problem that keeps going, but as Ms. Lewis said, you know, hope, love, connection, wraparound services, communication, that's huge, and keeping grasp and hopefully start to win the battle on addiction as it relates to opioids and fentanyl.
Thank you, Chief. And you know what, I am going to take a moment to brag on the leadership in the Village of Broadview, only because every day we walk into this office, we don't know who's walking through the doors. And so we practice love and kindness. Everything we do is about love and kindness in the Village of Broadview. And I take pride in that because it makes me feel good that we can have a police department that can interact with the public. And, you know, we get the complaints sometimes, but it's not nothing that we can't overcome. It's just coaching people through circumstances. And I tell the staff and the leadership team every day somebody walk through that door, sometimes we just need to listen. Because you can get a lot of information by listening, because now we know how to direct it to the social worker. I will call the chief and say, I need you to follow up with this person. Can the social worker go out to the house? And so the social worker does all of those things. So the wraparound services that's available to us, we utilize that. But we rely on each other to help another person, because every day above ground is a great day. That's right. Regardless of your circumstances. And we all have circumstances at some point, right? So I take pride in that, and I give kudos to our police department, because it's full circle of seeing those that's been in the police department over 20 years to see where we are now versus when they started as a young officer in the Village of Broadview, and what it looked like then and what it looks like now. And I can truly say that our police department practice love and kindness every day. Every day. The fire department get a lot of love because, you know, they care and help people. We're on the reverse. It's not like that on the police side, but now I can honestly say it's like that on the police side too in Broadview. So we take pride in that. So thank you, Chief, for your leadership. So Pastor Harrell, what are you seeing in the faith community, and how can we support each other as a whole, and how can we encourage people to seek out their faith connections?
Well, thank you, Madam President, for such an awesome panel. I have the pleasure of working with most of them here. But it's really important that as faith leaders, we just get the information. The only way you can do that is coming outside of those four walls and putting boots on the ground and actually working with all facets of the community. Me and Dr. Dew have many conversations because I like to tease him, but it's really not a joke, because he really is the GOAT at what he does.
That's
right?
true.
I mean, he
That's
really
true.
is. And he does it so graciously. And so it's important that we take these barriers down of the stigmas that something is wrong with them, that you can't embrace them. And people don't know how much you care until they know how much you care. And talk is cheap, and people are looking for some real help. And the one thing people can analyze is how much you care. Do you really love me? By the way that you treat other people. We moved out here in '89 from the west side, Central Park and Augusta, where she grew up as well. But it's a total difference as to what it used to be as to what it is now. And certain areas on the west side has changed as well, because you have people like Donald Dew and other leaders that really care. So what can the faith do? Well, people of faith, we can share the information. And as leaders in faith follow other leaders in faith. Tell them to come. They won't know, what do you do so well? Well, what I do so well is I come outside them doors, and I stay outside them doors. I go in at night, I be wore out, but what keeps me going is the love and the passion and my commitment for the people. And so, again, I want to thank you for always leading the charge and putting such an awesome panel together. And it's always great to be on with Dr. Dew.
Well, just know that this won't be you all's last time coming to Broadview to talk about it, because it's a conversation that we just can't have one time. And we only got an hour of time to spend together, but we probably collectively can come up with a plan where we can have more in-depth conversation related to specific topics, especially when we're talking about the opioid crisis, mental health, and then how we get the wraparound services to love on someone to get them the help that they need when they're ready. So I like when Laura said that, you know, if you could save one person
Yeah.
by providing clean syringes, by providing the things that they need to keep them alive and getting them the health services that they need, God is pleased with the work that we're doing as servants. So I'm happy that this panel have a faith base. They have some conscious of who God is. And so that pleases my heart a lot, because everything I do is in the honor of God. So I appreciate your leadership on the panel. So Dr. Goshi, can you kind of walk us through what the strategy is to combat what we're facing with the opioid crisis?
Yeah, thanks for those, again, for those comments, Mayor Thompson. So when it comes to work that our health department is doing, I'm really proud to say that there's a lot that's happening. I've been with our health department now for almost 10 years, and when I first started, there's really not much activity happening in the behavioral health space. And so when I would come to forums like this, there's really not much for me to say. So fast forward now 10 years, and thanks to some real strong advocacy on the part of our commissioners and the office of our president, we've been able to mobilize quite a bit of resources and funding through the American Rescue Plan Act, ARPA, to start to grant out funds to focus on building our behavioral health systems. I think somebody mentioned how, you know, sometimes addictions and behavioral mental health problems can go together. Well, we need to address both. And so our most recent efforts focus on building those systems and making sure that, for example, if you've got a community health center in your neighborhood, that health center can hire a social worker to provide counseling. Granting funds to a school to help kids with social and emotional learning. These things are preventive. If a kid knows how to manage their stress, how to eventually, over time, come to terms with their trauma, and again, this takes time, then we can really kind of vaccinate them against the potential for addictions as they get older. And then, of course, we're also funding organizations to provide services like naloxone. And so we've been talking about naloxone quite a bit. I don't want to make any assumptions because I've done that previously and it's caused problems. So naloxone is a medicine that can be inhaled or injected by a layperson. Typically, the intranasal version is for lay people. And it can save a life if somebody happens to be overdosing from an opioid. So we're doing as much as we can to make that medicine available widely. We've been focusing on law enforcement primarily and community-based organizations, thinking particularly with our community-based organization partners. They really know their communities and will help us get the naloxone out. Shortly, I think I'd really like to see us do even more. So we're planning to do things like purchase naloxone vending machines so that you could just walk up as if it were like a newspaper stand, for those of you who remember what those were, open it up and just grab some naloxone. Again, we want to blanket the community with this life-saving drug. So there's a lot of work that we're doing. Some of it revolves around naloxone. Some of it is more in the behavioral health space. I could say a lot more here, but I do want to be conscious of time. Thanks again for the opportunity, Mayor.
Thank you, Dr. Doshi. So we are at 7:30, and I like to respect everyone's time. I know we've had a long day. I had a board meeting last night and then followed with another meeting tonight. So, but I want to respect everybody's time. I do want to say I appreciate all of you all that's on the panel that took your time out to spend time with us in Broadview, for sharing some stories, sharing some resources that you have available, and if it's anything that you all could leave behind with us, we're more than happy to share that with our community to get the information on how to seek the resource and how to get it. I know, Haley, I want to say thank you for putting this all together, and Cecile and my assistant Lily, who kind of coordinated the schedules to put all of this together. So I appreciate the support that you provide to leadership. It's a big deal, and your job is endless because it's always going, so we appreciate that. We appreciate the residents that showed up in person, and we appreciate those that's watching on live. On the YouTube channel. After this, we are streaming live, so the video will be available for those that want to share the video on your social media, or however you share platforms. We will have that available. It will be on our social media, and it will be on our website, so where people can view it later if they didn't get an opportunity to chime in at the time that we started. I want to turn it over to Commissioner Aguilar for final wrap-ups, and so it's going to be a training at the end of those that want to learn how to use the product. I think it's important for all of us to, I have one in my office, and I was sharing with Haley, it's in my office. It's not gonna do me no good if I'm in the field. So maybe I should put one in the glove box. I don't know, but y'all can help me make that decision tonight. So Commissioner Aguilar, you wanna wrap it up? And I do wanna say that we do have our village clerk here. So thank you, Clerk McGreer, for being here. And Commissioner, don't forget to talk about this.
Again, thank you, Mayor Thompson, for hosting this in the village of Broadview. I want to thank the panelists for having this discussion, a very serious one, a lot of information. But for those who are suffering from addiction, it is a illness, as Dr. Joshi said. It is an illness, like diabetes, like heart disease, and so forth. And that's how we have to address it, with patience, with love, like Mayor Thompson said. I had a nephew who overdosed, and the last several months that I spent time with him, I learned a lifetime of information just talking to him. But there is hope out there for those who are suffering from addiction. You're not alone. There's hope, and there's a light at the end of the tunnel. So just keep going. Follow your counselors or your advisors that are leading you towards that light, and you'll make it. So again, thank you for having this forum here. On October 28th, I believe, 28th, I'm going to have a health center, health information. We're going to address HIV tests. We have Walgreens for vaccines and flus. A lot of fun. It's celebrating the Day of the Dead, Dia de los Muertos. I usually get a good group, and we will also talk about addiction and so forth. So again, there's hope out there. Hope to see you in my district. It's going to be at 7833 Ogden Avenue on October 28th, which I believe falls on a Saturday. Saturday. So again, thank you again.
Thank you, Commissioner. So before we wrap up, I would just want to tell you how this all came about. So Commissioner Morrison had posted on social media that he was hosting a forum like this. He is not my Cook County Commissioner. At the time, we were in transition with the first district seat because now our first district commissioner was now Mayor Johnson, and we just got it. So I reached out to Commissioner Aguilar. I'm fortunate and blessed to have two commissioners, so I get leverage. And so I reached out to Commissioner Aguilar and told him that I had saw what Commissioner Morrison had did for the opioid crisis, and we needed to have it in our community too. And so he put a panel together, got the county involved, and some of the network that I have, I invited guests to come to have this conversation in Broadview because we're not exempt. And we have to recognize that we're not exempt. But what we should be is proactive in having these hard conversations and getting the information and getting the data and not forcing people into treatment, but showing them that it's really a life. Once you make the commitment, you won't help. And so I'm happy to take the lead, and I'm happy to be the front runner on having these hard conversations because it's necessary. And so we all are servants of God. Well, we all are servant of God, and He's ordained us to put best practices in place to help save somebody's life. So thank you on behalf of the Village of Broadview, the Board of Trustees, and our leadership in Broadview. I really appreciate you all spending some time with us this evening, so thank you.
nobody up there looking at us, right?
That's why I pulled mine out, because I do stuff really dumb to
Thank you.
do. That's how I see it. Sir. Yes, yes, sir, yes, sir. Commissioner.